This is a virtual poster presentation for the 2020 Nurse Educators Conference in the Rockies. My poster presentation is entitled Addressing Mental Health in the Hospitalized Client. Finding mental health only clinicals can be quite difficult, and in nursing we deal with mental health no matter where we work, whether it's ER, ICU, OB, or the med-surg floor. So we developed a scenario that involved complex medical surgical needs along with mental health. For our simulation, we used one clinical group of 8 to 10 students. They did 4 hours of simulation for each student, but we did it all at the same time, so it was 4 hours of faculty workload. We used the observer role, so 2 students performed and then they watched the other scenarios, but occasionally they would get called in to help depending on what was going on. We also used a live patient in this scenario. We had a family member of a faculty member volunteer. He was actually a police officer, so he brought in some realism and some of his own acting because he's dealt with these patients also. And we had a faculty member who played his wife, so that brought in another complex part, so they had to educate and teach and communicate that also. The scenario we used was actually a 53-year-old male who fell and fractured their hip while getting off the Greyhound bus. They were getting kicked off because they were starting to go through alcohol withdrawal. They had actually gotten married in Vegas and got on the bus in Vegas and were traveling to get to their family. So the wife was present in the room as well as their trash bag of belongings, which had interesting things in it. The patient had a history of COPD, alcohol use, and smoking. So on admission, he has a fractured hip and he's going through alcohol withdrawal. Throughout his stay, he has multiple other complications that students have to address. They had to use CWA because he actually would hallucinate and he would be disoriented and he would be sweating, so they could actually rate him on a number and give him lorazepam based on that. He was combative and he actually removed his IV and his Foley, so then they had to reinsert those. They had to get an order for restraint, so we quit pulling out things. He went hypoxic, so they had to give breathing treatments and steroids because of the COPD. He was hypovolemic post-op, so they had to give fluid bolus and give blood, so then they had the potential for blood reactions. Then there was a complex family dynamics with the wife at the bedside, and they were newlyweds, so it was a interesting dynamic that was involved. They had all their belongings in a trash bag, so there were empty liquor bottles the students may have not been aware of, or empty pill bottles, and they left him once and came back and he was passed out and he had jelly beans, which were simulating pills, going down his shirt. And his wife said he was treating his pain because they weren't, so he was actually overdosed on medication. They had to do pain management. They had to do sepsis because he started running a fever with everything else going on. There's a lot of things that can go wrong with this patient that can also incorporate his mental health component of being an alcoholic. Students loved these scenarios. They loved having a live patient. They got a lot of hands-on skills with applying the restraints and having to reinsert Foleys and IVs on, we used mannequins for that part, of course, but just the ever-evolving and different scenarios. And then when they had to apply restraints, they had to get classmates to come back and help, because you're never going to tie down a patient by yourself in this situation. You're going to have friends, and we talked about safety and what we needed to do in that situation and how to involve security or how to best protect yourself and the patient. It was just a great scenario that met a lot of our needs and goals. If you have any questions, you're more than welcome to contact me. There is my email address, and I appreciate your time.